Members, there is a growing push for mandated vaccinations in the area of COVID-19. Some entities such as healthcare facilities, long-term care facilities, and municipalities are already requiring vaccinations as a condition of employment. My office has heard from multiple people around Texas who don't even work in healthcare, yet are still being required to get the COVID-19 vaccine as a term of their employment. Outside of the realm of employment, there is an increasing concern that individuals will struggle to continue functioning normally in a society as a whole. Senate Bill 1669 does two things to address this issue. It prohibits vaccine mandates, whether public or private, and prohibits all discrimination and right of access restrictions based on vaccination status or proof of immunity. In short, this bill will prevent any type of discrimination or segregation based on vaccine or immunity status and would prohibit forced vaccinations across the board. If you are an individual who has chosen not to take a particular vaccine or vaccines, this bill will help ensure that you can get or keep your job, your health or life insurance policies, your access to government and private services, and more. The chief responsibility and constitutional role of our government is to protect the rights of the individual. Employees can take off their helmets, masks, or uniforms at the end of the workday. They cannot remove a vaccine. Vaccines for 20 different viral and bacterial illnesses not included in COVID-19 are on the CDC's recommended adult vaccine schedule. It is not right to treat unvaccinated individuals as if they are sick individuals or as if the choice they have made is morally wrong. No one in our society should be hindered from participating in business, schools, or our government just because they have made a very personal decision for themselves or for their children not to receive a particular vaccine or vaccines. The mere fact that a person has not received a specific vaccine does not make them a threat to others' health and safety. In contrast, vaccines they have elected not to have may very well be a threat to their own health and safety. It is no secret that the COVID-19 vaccines are not FDA approved. The governor himself recently said, and I quote, "Here is a reality everybody needs to understand. These vaccines have not been formally approved by the FDA. They have been approved for emergency use operation, and that means no one can be required to take the vaccine." A little bit of history. In 2019, there were reported to the VAERS 203 vaccine deaths. In 2018, 119, and 27, 85. Since December of 2020 through April 23rd of 2021, 4 months, there have been reported 3,362 deaths for COVID vaccine. That's roughly 30 people a day dying from this vaccine, or one of them. Vaccine Adverse Event Reporting System, VAERS, is estimated by most people that follow it as being less than 1% of what actually happens. In the 4 months of 2021, we've had more COVID-19 experimental vaccine deaths than all the vaccine deaths for the 15-year period between 1997 and 2013, plus almost 1,000 heart attacks and over 8,000 hospitalizations. In 1976, there were 45 million people were vaccinated for the swine flu. A mere 15 people died, and I don't say that lightly because any death is very regrettable, but the program was immediately halted because it was considered too risky. 53 deaths, and we've had approaching 4,000 with the COVID. Even vaccines that are FDA approved can still have significant side effects. The FDA's Vaccine Adverse Reporting System contains 44,383 reports of Texans suffering from adverse events following vaccination. The federal government has also paid out more than $4.5 billion to vaccine victims through the National Vaccine Injury Compensation Program. The law passed in 1986, which created this compensation program, shields vaccine manufacturers and the medical personnel who administer the vaccines from liability. If a business requires you to take a vaccine, All the risk, physically and financially, is on you personally. The business has no responsibility if you have a mild adverse reaction, a lifelong disability, or even die. No one but you have to carry all the risk. The pharmaceutical companies and medical personnel have absolute and total immunity from anything that happens to you. You and your family will carry the entire burden, no matter what it might be, for as long as it may last. Our state has a tradition of being a safe haven for people to exercise their rights of life, liberty, and the pursuit of happiness. It is time for us to be a leading example to the rest of the nation.
Thank you, Senator. Members, any questions for the author at this point? Very well. We'll open testimony, begin with invited testimony. We'll call Dr. Richard Bartlett. Dr. Richard Bartlett.
Good morning. I'm Dr. Richard Bartlett, and I understand we might have some physicians on the committee, and that's great. We've been talking for the last year, since January 1, 2020, about COVID, vaccinations, and we have basically, there's been a lack of information promoted on early outpatient treatment. If people had COVID, they were told if you have mild to moderate symptoms, just stay home and tough it out with Tylenol. If you have, and then if you're sick enough, go in the hospital and we'll make a ventilator for you. And we started pumping out ventilators. But at the beginning, 90% were dying with ventilators. And we were told to hold our breath and wait for a vaccine. But there is good news. Oxford University finished the STOIC trial. And in the STOIC trial, they found that 90% of hospitalizations for COVID patients could be prevented with early, effective, with one medicine, inhaled budesonide. 90% of ER visits, 90% of urgent care visits could be prevented, according to Oxford University, the oldest university in the English-speaking world since 1096. 72 Nobel Prize laureates. They're a reliable source of information. They also did a second randomized control trial, which is the gold standard for medical and scientific fact. That was the principal trial. And so both of them showed overwhelming success at helping people recover quickly, outpatient, early. It's a medicine that's safe, readily available, inexpensive, and it's FDA approved, as opposed to the COVID vaccines, which are not FDA approved and by definition experimental, because we haven't had the time yet to vet their safety and efficacy and stamp them as FDA approved. But we have medicines that have been out for budesonide's been out for 28 years, FDA approved. It's been used on 2-pound preemie babies in the NICU for decades safely. That's about as delicate a human as there is. So as far as safety, we have that, but Oxford showed the efficacy. And so my point is that we have alternatives to an experimental vaccine. We have a safe, readily available, inexpensive alternative. And patients should have their individual right to decide what direction they're going to go. Yeah, so I'm an ER doctor, and I teach advanced trauma life support, and in that we stabilize patients, airway, breathing, circulation. Breathing's very important. And with COVID, it's a viral respiratory infection. We've had other viral respiratory pandemics. The H1N1 pandemic, we didn't have a vaccine to recover from that. It was herd immunity. That was a deadly disease. The polio epidemic, we did not have early, safe, effective treatments, therapies. And with this, we do. And the evidence is there. Oxford University has done the randomized controlled trial that just one of the possible treatments, budesonide, can prevent 90% of hospitalizations. Can you imagine? 90% of 500,000 would be 450,000 Americans that died. They usually die in the hospital. Does that mean 450,000 Americans could have possibly been saved if they were treated with early effective treatment?
Okay. I guess the only other question I have is that it appears that the mandates are being level across the board without regard to the person's susceptibility or risk level, or whether they've had the COVID or not. Do you see any problem in people that have actually had the COVID getting the vaccine? Are those
That's
aren't
an
at risk?
excellent question. And so, working in the ER, I'm now seeing more people come in who are having complications from the COVID shot. They're short of breath for 2 weeks after they received the shot 2 weeks before. They're having temporary neurologic episodes where their legs don't work and they fall flat on their face. They're having dizziness, shortness of breath, and lightheadedness and feel like they're going to pass out. And so I'm seeing more, at this point, more complications from the shot in Lubbock, a college town, 18-year-olds coming in excellent health before the shot, coming in 4 days later with 4 days of symptoms. Thank you.
Thank you for your service.
Doctor, thank you for your testimony. Thank you for being here very much. The chair calls Dr. Ben Edwards.
Ben Edwards, trained as a family physician, did my undergrad at Baylor, UT Houston Medical School, and then Waco for family practice residency training where I was chief resident. I spent the first 7 years in private practice at Garza County Health Clinic in Post, Texas as the only physician in the county. The last 7 years, 8 years, I've had my own practice, Veritas Medical, in Lubbock, Abilene, and San Angelo. We have offices. Thank you for the opportunity to testify today. I'd like to begin with a reminder to everyone about the definition of evidence-based medicine that Sackett, Strauss et al. Laid out back in 2000. They stated that the elements of evidence-based practice are the integration of best research evidence with clinical expertise and patient values. Patient values trump clinical expertise, and clinical expertise trumps the scientific evidence. I'm also concerned that the forced and coerced COVID-19 vaccinations would, in my opinion, be a violation of the Nuremberg Code, the UN International Covenant on Civil and Political Rights, Article 7, the UN Universal Declaration of Human Rights, Article 3, and UNESCO's Article 6 of the Universal Declaration of Bioethics and Human Rights. According to the CDC's vaccine adverse event reporting system, which I have some updated numbers from last night when I downloaded these, 4,178 deaths are now being reported on VAERS. To give some context, over the past 20 years, all vaccinations combined, there were a reported 4,182 deaths over the past 20 years. In the past 4 months, we're now sitting at 4,178 deaths associated with the COVID vaccine reported to VAERS. This includes a 15-year-old boy in Colorado, 2 16-year-old girls in Wisconsin, a 17-year-old girl in Wisconsin, and a 17-year-old boy, all healthy. He was in New Hampshire. The evidence is pretty clear that VAERS grossly underestimates the adverse events that are reported. A study commissioned by the Department of Health and Human Services, this is in 2010, and Harvard carried out this study. And the conclusion was only about 1% of adverse reactions are ever reported to VAERS. A similar study in 2015 by Shimbukru et al. Came to a similar conclusion. A 1995 report by CDC also found that certain adverse reactions to vaccines are reported about 1% of the time. Even the vaccine manufacturers themselves have estimated a 50-fold underreporting of adverse reactions. So I have grave concern about the underreporting of these adverse reactions to VAERS, and even at that, we're over 4,000 now in deaths. To give you some context, as Senator Hall already mentioned, the 1976 swine flu epidemic, after recording 500 cases of paralysis and 53 deaths, the vaccine was pulled off the market. Personally, I've received numerous reports from family members of my patients, close friends to my patients, that within hours to days of receiving the vaccine, they've suffered from stroke, heart attack, pulmonary embolism, blood clots, sudden death. And as far as these family members knew, none of these were reported by the medical staff as being associated with the vaccine. So my concern is there is indeed a vast underreporting. Lastly, I would say that of Harvey Rich's data that 53% of Texans have natural immunity. Studies have shown a 2 to 3-fold increased risk of adverse reaction to this vaccine if you've already had COVID. Natural immunity infers a more robust immunity than vaccine immunity could, but vaccinating someone who's already robustly immune increases their risk of adverse reaction 2 to 3-fold. 2 different studies that show that. And probably the last thing I would have to say is I'm very much a proponent of preserving the individual doctor-patient relationship. It's a sacred relationship, and I believe nothing should come between that. And ultimately, it's up to the patient to decide how they want to treat their body. And on a personal note, I believe that God gave us an amazing, robust immune system, and I don't think you can improve on God. Not everyone obviously has to agree with that, but for those that do and choose to rely on that natural immunity, I think we need to uphold that right to do so without any adverse outcomes on their livelihood. Natural immunity is more robust than vaccine immunity. There's a study from the original SARS back in 2002. The people that survived that first SARS, they've looked at them 17 years later, and they showed a robust immunity still to SARS-CoV-1 17 years later. Historically, we've always known that natural immunity tends to last a lifetime, i.e. the measles. Natural immunity will last a lifetime. So no, I don't believe there's any need to vaccinate someone who's already acquired natural immunity. And we need to remember natural immunity is more than just antibodies. You have T cells, natural killer cells. You've got the innate immune response. You've got a robust immune system, not just antibodies.
Can people do anything about their immune system?
Absolutely. Thank you for asking, Senator Hall. I transitioned from conventional family practice medicine to integrative medicine, integrating our God-given natural ability for the body to fix itself. And it's clear in the literature that if we steward this God-given design through nutrition, proper nutrition, hydration, exercise, sunlight, most importantly, peace, not fear. Fear has overcome this nation. The spirit of fear that I don't submit to has overcome this nation, in my opinion. And if that's influencing policy decisions, I don't want to have to be subjected to those policies. So yes, there's much that you can do to improve your immune system. And it sounds too simple, but it's true. Eat God food, not man food. Exercise, get some sunlight, move around a little bit, and most importantly, be at peace. Your immune system will do what it's designed to do. Thank you.
Thank you, Dr. Edwards.
Doctor, thanks for your testimony. Thank you for being
You're welcome.
here.
Thank you all.
Very much. The chair calls Dr. Amy Offit.
Good morning. My name is Dr. Amy Offit. I'm a practicing physician in Marble Falls. I've been practicing in the Texas Hill Country for about 21 years, and I'm here today to provide my own medical opinion regarding the current state of COVID-19 medical management in our state, specifically related to whether or not requiring the EUA COVID-19 injection is appropriate. What makes me uniquely qualified to speak today is that I've been actively, successfully treating patients since March of last year for COVID-19, acutely outpatient with effective treatment regimens. I first drafted a treatment plan after researching strategies in late 2019 when I saw what was happening in other parts of the world. And then I fine-tuned it with input from other U.S. treating doctors like Dr. Bartlett over the course of the past year. Because these treatments were working, despite all the controversy, out of a strong ethical obligation to care for my patients, I continue to treat as the numbers of sick people increased last year. As of last Friday, my practice has treated 579 acutely ill patients as old as 98 years of age, with only 10 hospitalizations and 1 death. The man who died, presented on the 12th day of illness, was a transplant patient and had already been to the ER multiple times before seeking care from us. Of 433 other patients who've been given preventative regimens and tracked, only 10 have developed COVID and were easily treated, resulting in an illness rate in my practice of less than 1% for those taking preventative medication. These data are real. They're my own numbers from my own practice. One of the main things I wanted to share today was that informed consent is the core to shared decision-making and good medicine. In fact, the American Medical Association has published a code of medical ethics about informed consent that says, informed consent to medical treatment is fundamental in both ethics and law. Patients have the right to receive information and ask questions about recommended treatments so that they can make well-considered decisions about care. Successful communication in the patient-physician relationship fosters trust and supports shared decision-making. That builds on some of the previous testimony about sharing in these decisions with our patients. Presently, we're hearing stories about companies and universities requiring these injections in order to remain employed or enroll in school. Such mandates for college students is especially surprising to me as they are some of the most low-risk individuals. This simply doesn't make medical sense. Even referring to the package inserts for these injections gives us further evidence, and I've pulled some language from those. Additional adverse reactions, some of which may be serious, may become apparent with more widespread use, and that the following must be communicated to each recipient or their caregiver prior to each dose. It must be communicated that these are not FDA-approved vaccines, that the recipient or their caregiver has the option to accept or refuse the vaccine, and that the significant known and potential risks and benefits of the vaccine and the extent to which such risks and benefits are currently unknown. With these mandates, if we turn to the VA-ERS data, which has already been presented today, there are significant numbers that we need to listen and investigate further. In fact, I checked last night here in Texas, you can query just for the state. It currently shows that there have been 47 Texans who have died following Pfizer injection and 62 following Moderna injection. And I can tell you from being a practicing physician that many times if someone dies a few days later, if the doctor doesn't believe it's related, they don't even think about reporting it. I encourage you to look at the data for yourself. You can go online to vaers.hhs.gov. Safety has got to be a priority for our state as we follow ongoing data collection for these injections, which are still under study. The package insert goes on to report that there's insufficient data to inform pregnant or breastfeeding women about the risk associated with this vaccine, but we are still allowing it. The package insert also discloses that the safety data for adolescent minors is extrapolated from adult data, and extrapolated data shouldn't be used to make such decisions. My medical opinion is that we must preserve Texans' right to have medical autonomy, especially in this situation.
Doctor, thank you very much. Senator Hall, any questions for the witness?
Just a couple.
Go ahead, please.
You've now treated over 500 patients. What would you tell one today, somebody coming to see you thinking about doing the vaccine? What would you tell them?
So I think based on some of the previous testimony, I agree that if they've already been sick with it, they should have a naturally acquired immunity that should be protective. And I would ask them to honestly wait a little longer and let some more safety data be collected before deciding if they haven't decided. And at the same time, I agree with one of the previous speakers that it is the patient's choice. If the patient wants the vaccine and they feel confident in it, I encourage them to read and make an informed decision and then proceed how they feel is best.
And you have worked with vaccines in the past. This is not an issue of vaccines in general. We're talking about COVID.
Yes, I'm not against vaccination. I think it should be each person's personal medical situation that's considered. We do that with every medical decision. It's risk versus benefit with each person sitting in front of us every day, each decision we make.
So how did you manage to get through this? I assume you are okay with the COVID, got through it okay. What did you do for yourself and your staff?
So I myself took the preventative regimen that I've prescribed for my patients, and I offered it to all my staff. If even my staff wanted the vaccine, I told them to get it. I'm not against it. I just think it is a bad idea to just shotgun give it to everyone. There are too many other factors to consider.
Thank you, Dr. Offit.
Thank you.
Thank you.
Chair calls Dr. Angie Farella.
Thanks for having me this morning. My name is Dr. Angelina Farella, and I am a pediatrician in Webster, Texas, independent solo physician. I have come here today really to protect our children of Texas. This is a very scary situation that we're in right now. I just want to kind of touch on a few things, some history. Never in history before have we given medications that were not FDA approved to people that were not initially studied in the trial. There were no trial patients that were under the age of 18. There were no trial patients that were previously exposed or had COVID. These are two very important points with this. The other issue is safety. I'm kind of a safety freak. I'm a pediatrician. I've been a pediatrician for over 25 years. I find myself a vaccine expert. I've given tens of thousands of vaccines in my office. I am not an anti-vaxxer. I'm a very pro-vax, actually, except when it comes to this COVID vaccine, if we can call it that. One of the big issues is the safety profile. The safety and the adverse events recommendations through the ACIP, which is the Advisory Committee of Immunization Practices, they have made some recommendations in regards to the COVID-19 vaccine. One of the things that is extremely troubling, and it's on their ACIP guideline for the Pfizer vaccine in particular, that recommendations about safety and adverse events will come out after authorization. After authorization. This is a very scary issue. We find out data on safety before we subject our patient population to this. We are currently allowing children 16, 17 years old to get this vaccine, and they were never studied in this trial. On top of that, these kiddos, they're extrapolating the data from adults down to children and adolescents. This is not acceptable. Children are not little adults. Not acceptable at all. Children have a 99.997% survivability from the COVID. 99.997%. Let me repeat that for you all to understand. And there's evidence that these children are actually a buffer. What that means is that these children actually, for some reason, do not spread the disease. Children are not super spreaders. So what we're doing to our kids right now is actually criminal. We are isolating them. We are putting them in masks, which is also clinically dangerous. We are also telling them that, psychologically telling them that if they bring COVID home, they're going to kill grandma, granddad, aunt, uncle, mom, and dad. That is a horrible, horrible situation to put on our kids. Let me go back to the rotavirus vaccine of 1999. I've been in practice long enough that I actually was giving rotavirus back in 1999, and it was pulled off the market then because of 15 cases of intussusception. Intussusception is where the gut telescopes on itself. Intussusception is not necessarily life-threatening. It sometimes self-reduces, but the rotavirus vaccine was actually pulled immediately, and we stopped giving it to our kids. And what has happened with this particular vaccine is appalling to me. We have in excess of 4,000 deaths, and this thing has not been pulled yet. This is absolutely unacceptable. We now have early, effective outpatient treatment for COVID. We've had it for a long time. As a pediatrician, I stepped up to the plate in Texas to help Texans, adults, because doctors in my community shut their doors, locked their doors, and refused to treat patients. I've seen hundreds of adults, active COVID. I've also treated post-vaccine problems in adults. Thank you for allowing me to speak.
Any other questions for the witness? Senator Hall.
With your experience, you're talking about going back to 1999 or maybe before, has there been another vaccine that had the high incidence of serious hospitalizations and deaths that this vaccine is now showing?
Not to this extent, absolutely not.
Not even,
this one,
not even
close. Not even close.
Any other vaccine would have been pulled from the market.
Absolutely. It would have been pulled probably within the first few, just
Right.
as we've seen in the past. What was it?
And have you seen any other vaccine that was put out for the public that skipped the animal test?
Never before, especially for children.
And as what I've read, they actually started the animal test, and because the animals were dying, they stopped the test.
Correct.
Folks, I think that's important to understand there, that what we're talking about is the American people are now the guinea pigs. This is the test program that's going on. They didn't do the human testing, and they stopped the animal test because the animals were dying. And then they turned it out for the public. and we are now looking at businesses that want to mandate that this experimental vaccine be given to people as a condition of their employment. And yet we have this death count that continues to rise and be totally ignored out there. So, do you agree with what I was saying, Doctor?
Absolutely.
Okay. Thank you very much. Appreciate you and your work.
Thank you, Senator Hall. Senator Lucia.
Question of Senator Hall.
Yes, sir.
That's a pretty strong statement. Do you have data that we can look at to see what happened on those?
It's on the CD's website.
It's on the TV website. Can you direct us to that website? I'd like to see that.
I will get you. Yes.
I'd like to see if they how many they tested and in fact if they stopped testing because animals were dying.
Yep. Okay.